every single question, but we're going to do our best to get through as many as we can. So now I want to bring in Dr. Persse. Dr. Persse, thank you so much for taking the time to chat with us this morning. I want to start with the big news that broke yesterday, that Governor Abbott has a breakthrough case of COVID-19. He is fully vaccinated. What was your reaction to hearing that news?
Well, three things. Number one is I hope that the governor does well, that he stays healthy. Number two, I would point out that, if you're going to behave like the governor has been behaving, and that is to be not wearing a mask and to be in crowded settings, you're going to get exposed to the virus. And even if you're vaccinated, if you put yourself in situations where there's lots of virus around, your chance of becoming infected is really pretty high. Remember, the vaccine is very protective, but it's not 100%. And it's also, its best impact is keeping you from becoming hospitalized or dying. It doesn't mean that you won't necessarily become infected and get sick. So it's not 100%, but it's highly effective. And I think that what we take away from the governor is that if you put yourself in those situations, you're going to be exposed. You may contract the virus. If you've been vaccinated, you're going to do a whole lot better than if you're not vaccinated. And I really wish the governor well, and I hope that he stays healthy.
One of the things that his office announced was that he's getting Regeneron's monoclonal antibody treatment. Is that a treatment you would recommend for other breakthrough patients?
So there are criteria for who gets the Regeneron and who gets the monoclonal antibodies, and they're fairly liberal, and they generally work much better the earlier on in someone's illness. Now, I'm not the governor's doctor, so I won't speak to whether or not he met the specific criteria for it. I will assume that he did. But in general, the monoclonal antibodies, when given to the right patients and given early, are highly effective. We're getting really very satisfactory results from the monoclonal antibody therapy. And you're seeing that there are infusion centers being set up across the state. In fact, the state itself is helping to support some of these so that we can get the monoclonal antibodies out into the community much more readily than we've been able to with traditional methods. So in any community, there are infusion centers, and they're generally used for chemotherapy patients, but they're full. They've got chemotherapy patients filling up their schedule anyway. So I'm glad that the state and the federal government are supporting making that a more robust network of ways for people to get the monoclonal antibodies.
You touched on this a little bit when we were talking about Governor Abbott, but the issue of breakthrough cases has stirred up all kinds of conversation and concern about how effective the vaccine really is. And you just said it was never meant to be a cure, but it's another layer of protection.
That's right. And thank you for the media for all the work that you've done. But the one thing I would criticize the media, and I mean the general media, not you in particular, but the general media, is that I feel that way too much attention has been paid to the breakthrough cases, particularly if it's a celebrity or a sports figure, because then it obviously leads to people saying, well, then why should I bother getting vaccinated? I can still get infected. And they're completely missing two really important points. Two really important points. One is that if you're vaccinated, your chances of becoming seriously ill, even if you become expected, is much, much lower. It's doing a great job of protecting you from getting hospitalized or dying. And the other thing is that if you look at the people who are becoming infected, it's the unvaccinated. So if you look at a chart, and we've got these charts, if you look at a chart of the folks that have been vaccinated and became infected, it goes on real, and then lately it started to go up a little bit. And that upslope is getting a lot of media attention. If you look at the unvaccinated, it's going like this. I mean, it's greatly overwhelming the number of vaccinated people who are becoming infected, but it's getting way too much media attention, leading to people saying, well, why bother getting vaccinated? You're just going to get sick anyways. That is not the truth. And so I would like to balance the message that if you're unvaccinated, your chances of running into trouble are exponentially greater than if you're vaccinated and you should happen to be one of the breakthrough cases, one of the rare breakthrough cases.
We've heard from the CDC. The CDC reports anywhere between 95 and 97% of COVID-19 positive patients who are hospitalized are not vaccinated. Does that reflect what you've seen?
Yes. So there are two numbers that have been floating around locally that I want to bring some attention to. Houston Methodist Hospital has said that about 87% of their patients, their COVID patients, are unvaccinated. Harris Health has said that over 98% of their patients are unvaccinated. So there's a fairly big disparity there, but you have to remember that the Houston Methodist Hospital, their system, they deal with a lot of patients who are at higher risk because these are solid organ transplants. This is your liver transplant, your kidney transplant, your heart transplant patient. They also deal with patients who've got the rare and very complicated immune diseases that would make the vaccine a little bit less effective. If you look at the Harris Health population, that is clearly more reflective of the general community. And they're seeing that over 98% of their COVID patients are unvaccinated. Less than 2% of those that are admitted to the hospital are vaccinated. And so the national average, right, as you said, I think is right around 91, 92% all comers.
I know one of the concerns you brought up yesterday was the lack of hospital beds and ICU beds available. Checking the Texas Department of State Health Services dashboard this morning, it says there are 44 staffed ICU beds available in trauma service area KHOU. So that's Harris County, 8 other counties in our area, covering about 6.6 million people. 44 staffed ICU beds for 6.6 million people has to be a concern for you.
You know, it absolutely is. And not only that, I would question whether those are actually staffed beds. I know they're listed that way on the state's website, but when we talk to hospitals, the staffing fluctuates. So the state has a value for the number of ICU beds in the region that, you know, usually or should be staffed. But I will tell you that in pretty much every hospital that I know of, there are ICU patients waiting in the emergency department to go upstairs because while there may be a bed, it currently is not staffed. And so yesterday I reported that SETREC looks across our 25 county region, and I don't have the numbers in front of me, but there was over 600 patients waiting for a general or isolation bed, and there were over 100 patients waiting for ICU beds just in the 25 county region of Southeast Texas. And a lot of that is due to, it's a combination of some hospitals have got the physical bed in the ICU, but they don't have the staff to manage it. And other hospitals, they just don't have any beds left. They're using the recovery room from the operating theater as a ICU and they've canceled their elective surgeries to create more ICU beds, and they've staffed it somehow. And thank God they have. But yeah, this is a huge problem. This is a real crisis.
You actually answered a question I hadn't even asked yet, because yesterday you did mention those numbers: 629 patients diagnosed with COVID-19 waiting for hospital beds, an additional 112 waiting for ICU beds. So that's for a 25 county radius around Harris County?
That's right. That comes from SETREC, the Southeast Texas Regional Advisory Council. And our SETREC, our local one is a 9-county region, but SETREC, the organization, actually looks at the data from 3 different RACs. And so it's a 25 county region total, and that's what those numbers represents, that 25 county region.
Okay, I know this is brand new this morning, but the CDC just recommended booster shots for all Americans 8 months after they get their second shot of either Pfizer or Moderna. And we get a lot of questions. If the vaccine is so effective, why are we talking about booster shots? Why are they now being recommended? What have you seen here in Houston?
Yeah, this is a great question, and I'm glad you brought it up. This is not at all uncommon with vaccines. So all of us are too old to remember that when we were little children, we actually got 5 doses of tetanus before we were teenagers to get our immune systems up and protected against tetanus. So it's not at all uncommon when you are being vaccinated with something new that your immune system would respond, quickly and robustly, and then within a few months later it would sort of wane and needs to be reminded, and then it would happen again. And this is not uncommon at all. And because coronaviruses, we've never had a vaccine for coronaviruses before, our immune systems are behaving just the way that we saw them behave with tetanus and with mumps and measles and rubella and other vaccines that we have. The difference is that we usually get those when we're little babies, and now most of us are getting them as adults. And this is why I usually only have to get my flu shot once a year. What's wrong with the vaccine? There's nothing wrong with the vaccine. This is totally normal. This is exactly what, we've been talking about this in my circles. We've been talking about the potential for this for months now, that this may be the case. And it is, and it's not a surprise, and it's natural. And this is what we need to do to get our immune systems to not only get up to speed, but to stay up to speed.
Dr. Persse, since this is something that you guys have had conversations about, you might have an answer for Pamela. She asked this question on Facebook. Does the Houston Health Department have a plan yet for how it's going to notify folks when they need to get that 3rd shot?
So that is a good question. And you can imagine this is going to be a huge logistic lift. We've got millions of people, in the greater, it's not just going to be the Houston Health Department, it's also going to be Harris County and the surrounding health departments. And we also now we've got CVS and Walgreens, which are giving vaccines. We've got doctors' offices, which are giving vaccines. And so there's a huge logistical lift to get everyone coordinated. And so we're having those conversations and we're trying to do that planning. And it's coming on pretty quickly. And so I fully anticipate that in the beginning, it's going to be a little bit confusing, and I will apologize in advance for that. It's just going to be really, really confusing, but we are putting the plans together to make it available to folks. And in terms of notifying them, that's in the beginning, certainly we're going to expect people to be able to do the math and figure out when their last dose was and has it been enough time for them to get their third dose. It'll be probably down the road. We need to figure out, exactly how we're going to be getting the shots into the people that show up. That's our first priority.
Got it. We just got this question in from Deshaun. He says he contracted COVID in between doses. Will the first dose help him fight it?
Well, with the wild type, the original variant that we saw, and then with the alpha variant, we saw that the first shot actually was fairly effective in giving people protection, but you really need the second shot. Now, this Delta variant is different. The first shot does not appear to give a whole lot of protection against the Delta variant. You really absolutely need to get that second shot to get an appreciable level of protection. So I feel bad for him that he got exposed. And if that happened recently, then it was almost certainly the Delta variant that he was exposed to between the first and second shot. So the first shot probably didn't. It sets it up so that the second shot can give you protection. But he probably was the Delta variant. And that's not a surprise, unfortunately.
And we've heard a lot about the Delta variant over the past couple of months. How are you guys tracking it? How do you know that it's the Delta variant that is causing this transmission in the greater Houston area?
Yeah, another great question, and thank you. And we really need to thank our colleagues at the Houston Methodist Hospital System, because they've been doing the sequencing on all of their positive cases, particularly the patients who are admitted to the hospital, and they've been doing the sequencing on that, which means that they take the virus, they send it to the lab, and they find out the exact amino acid sequence to determine which variant it is. And so we've been relying heavily on them. And so that's how we know that right now it is almost entirely Delta variant. I don't have the most current number in front of you, but I believe it's in the 90% range. We basically eliminated so we had, at one point we had every variant in the nation could be found here in Houston. We no longer have the California or New York variants. They're basically gone. The Alpha variant is down to very low numbers. We had Lambda for a while, and it has remained very low. The bully on the block, if you will, is the Delta variant. It's pushing every other variant out of its way.
You just listed all the variants. So we had Alpha, Delta, Lambda. How do mutations happen? And is there a concern about any future versions?
So mutations happen because when a person becomes infected with the virus goes into the cell, it sort of hijacks the machinery of the cell and starts making copies of itself. Now we talk about DNA and RNA. So DNA is double-stranded and RNA is a single strand of amino acids. And so with it being a single strand, there's a greater chance that when the cell makes a copy, that it makes a mistake. And so it is entirely likely, well, we know for a fact actually that there are many, many mutations that occur, but they don't go anywhere. They don't create any difference, because in order for that to happen, the mutation needs to give the virus basically a survival advantage over what was there before. And so this is where the Delta variant has taken off. It is more easily transmissible. It causes the cells to make many, many, many more copies than the Alpha variant did. And so that's why it has a survival advantage. It's able to propagate itself and promulgate itself more easily and more effectively. And so that's why it has taken off. Most mutations don't have that impact. And so they just sort of die off. Probably the great majority we never even recognize. You only recognize those that have some sort of a survival. Now your question was, remember I don't remember that exact number, but we got somewhere in the neighborhood of 6 billion people on the planet. And who knows exactly what percentage of them have been infected at this point. But in every person, when the cells are making millions of copies, at some point you're going to have a mutation. You're going to have a copying error that creates a mutation that gives the offspring, if you will, a survival advantage. And that's when we get things like the Delta variant. And so, yes, we remain concerned that there may yet be another variant which will be able to, promulgate itself even better than the Delta variant. Now, there's two things to keep in mind. One is its ability to promulgate itself, and the other is, how sick does it make you? And those are not directly linked. So something could spread a whole lot easier, but like with Delta, we're not finding that it makes you a whole lot sicker. We're just having a whole lot more people sick all at the same time.
That feeds directly into a question that Teresa just asked. She says, why do some people have no symptoms while others get very ill and some die? What do we know about its impact on the human body?
So one thing I'll tell you about this coronavirus, and I've been saying this from the beginning, it is breaking every single rule that we usually expect from viral illnesses. So for example, everybody's had the cold at some point in their life, and it generally goes to your nose and it bothers your nose and you get through it. But pretty much everybody who gets the cold virus gets cold symptoms. With the flu, it tends to go to your muscles, and you get the body aches, and you can get the cough and the sore throat, and that's where the flu virus likes to go. This virus can go to any organ system. We've seen it in the eyes, the brain, the heart, the lungs, the kidneys, the liver. We've seen it in every organ, the skin. We've seen it in every single organ system. And as you just pointed out, some people get no symptoms at all, and some people get terrible symptoms and wind up hospitalized, fighting for their life. And we have yet to figure out why one person has a worse experience than the other. We haven't figured that out yet. This virus is different from the others, and it's not the only coronavirus. Most coronaviruses that we've dealt with in the past have caused the common cold. So it's very different even from other viruses within its own family.
This is really why folks should get the vaccine, because it is that first line of defense against Alpha and Delta.
Yeah, absolutely. This is, the virus is going to do what viruses do. It is going to seek out and infect whoever can in order to make more copies of itself and spread itself. That's what viruses do. Our single best weapon is the vaccine. And there's been a lot of talk about, the problems with the vaccine. And yes, there have been some problems with the vaccine, but they are far more rare. And almost all of those people get over, they recover from. Even the 1 in a million complication people are recovering from, completely recovering from for the most part. I would far rather take my chances with the vaccine than the virus any day. And this virus is spreading so rapidly and so effectively that your chances of getting through this without getting vaccinated or becoming infected, they are rapidly approaching zero. This virus is not going to go away. It's going to be with us to stay. If you've ever got a cold in your life, why do you think you're not going to get this virus? It spreads much more easily, and it is probably here to stay.
We've heard that argument for months and months since the vaccine was available, but now that health argument doesn't appear to be working. So now agencies are offering financial incentives. Just yesterday, Judge Lina Hidalgo announced that Harris County is going to offer $100 for folks who get the first vaccine. I know Houston Health has been offering $25 gift cards. Have you seen any impact on the vaccination rates, do you think, as a result of that incentive?
We have seen some. We've had some people come. Our numbers are not what we had hoped for. Harris County offering $100, that's more money. We'll see if that makes a greater difference. But we've not seen the response that we wanted, and that's unfortunate. And I really wish that it had been the health argument that had won everyone over, and we didn't have to go to spending money to get people to do what's going to help them protect themselves and their family. Most important thing in the world to me is my family. I will do whatever it takes to protect them. I know people who have died from this. I know people who have gotten terribly ill and hospitalized. I know people that have got permanent disabilities from this virus. I'm going to protect my family. I'm vaccinated. My entire family is vaccinated. I don't know why other people would do differently.
I'm in the same boat. I am vaccinated. My 14 and 15-year-old daughters are also vaccinated. My boyfriend, everyone in our home is vaccinated. And I know one of the things that health experts have requested is that folks who are vaccinated share their story with folks who have some hesitation there.
Yeah. At some point, this virus will touch everyone. It's just too easily spread. It's too ubiquitous. It's not going to go away. And if it touches your family, I hope it, touches it in a way where nobody has a bad outcome. But we're seeing a lot of people have really horrible outcomes, and some have died. It's all avoidable. Yesterday, the city of Houston, we reported another 11 deaths. And all those deaths occurred since the beginning of July. Those are 100% preventable. They did not need to die. They were infected by somebody else, and they died.
Dr. Persse, I want to talk about schools. Katy ISD goes back to the classroom today. Masks are optional. Conroe ISD held a board meeting last night, pulled a mask mandate from the table, even though its own COVID-19 dashboard reports that there are more than 600 active cases within Conroe ISD. What kind of concerns do you have as kids return to the classroom?
So let me first say that I completely respect the school boards and their ability to make decisions for themselves, and I applaud them for taking on this challenge, because for those school board members, this is really controversial and a really difficult thing. So a shout out to the board members who are taking this on. Secondly, we are starting to see, tragically, an increase of serious illness among children. And the virus is doing what we're pushing it to do. It's going towards, it's either infected most of the adults, or adults have been vaccinated, and it's going towards the children now. Now, up until now, we've been doing a good job as parents of protecting our kids and keeping them out of crowded settings, and they were wearing masks for a long time. And so now we're dropping those guards, and the kids are going to be, at greater risk of contracting the virus. Most kids are going to do just fine. Some kids are not. And we're already seeing an increase in the number of hospitalized children and ICU admissions of children here in the Texas Medical Center and across the region. So, my advice is that, again, you need to do what you think is best for you and your family. And masks, they work. Now, remember, the mask that you wear does a fair job of protecting you from somebody else who's shedding the virus. It does a much better job when it's on the person who's shedding to minimize how much they shed the virus. So it works at both ends, but it works better if the person who, and with the kids, just many of them don't even know that they're shedding. This is why the mask mandates are I expect that they will be highly effective in the schools that do that. And we'll see what happens in the schools that don't.
A lot of the arguments we've heard at some of these school board meetings have been fueled by misinformation. And our reporter Marcelino Benito was up there for the Conroe board meeting last night. He heard from a grandmother who spoke out against the mask mandate. And I want to kind of go rapid fire with you through some of the claims that she made. Just let me know if they're true or false, and if you want to expand on that, you can. But I'm going to dive right in. So her first claim: these vaccinations are poison. Kids are dying because of the vaccine.
Absolutely false.
Masks do more harm to kids than catching COVID-19. Masks limit oxygen levels by making it hard for kids to concentrate. Kids develop diseases due to wearing masks, also ammonia, and can lead to lung infections in kids.
This has been well studied. That's absolutely false.
Masks don't protect you from catching COVID.
That is false.
Child hospitalizations are rising because of adverse effects with vaccine, not because they're catching COVID.
That is false. It's the opposite is true.
More people have died from the COVID vaccine than COVID-19.
Absolutely false.
If you take hydroxychloroquine, ivermectin, and zinc, you can beat COVID.
False.
Your immune system is 99.9% able to beat COVID, and it's the vaccine that lowers our immunity.
False.
You can sleep next to someone with COVID-19 and not catch it.
You can, but I wouldn't do it.
People have a 99% chance of surviving COVID.
What we're seeing is that if you've been exposed to COVID and you've contracted, you got about a 1 in 50 chance of being hospitalized, and then you got a 1 in 10 chance of dying. So I would say 99. I'd say that's false.
Thank you for answering all those. I know that's a lot of questions to throw out at you. We have one more. This came from Patricia. She asks, what about the Johnson & Johnson shot and its effectiveness? Do you think that's going to require a booster shot soon?
It's a really good question. I won't be the least bit surprised if they come out with a booster shot for Johnson & Johnson. I know that studies are being done right now, and that won't surprise me in the least. We found that it was really very good against the Alpha variant, less so against the Delta. And so that question needs to be answered, and it's being studied right now.
Well, it appears those are all of the questions that we've received. Thank you again, Dr. Persse, for taking the time. I want to give you the floor here at the end. Any final message for folks who are watching this, who have some hesitation about getting vaccinated?
Yeah, I would point out that we know that at least 2.5 billion people on the planet have been vaccinated. We have studied it to the point that we're finding the 1 in a million complication. And of those complications, most people are recovering completely and totally from those rare complications. We also know that there are a lot of people. Yesterday, we reported the 3,000th death of a person living here in the city of Houston. 3,000 Houstonians across the nation. Well over 600,000 Americans have died. I looked at a statistic the other day, and so far in law enforcement, just having about law enforcement, 537 law enforcement officers have died across the United States. That's more than double from COVID, 537. And I think that's more than double the number who have died from all other on-duty causes, whether it be a car wreck, a shooting, stabbing, whatever. More than double the number of law enforcement officers have died from COVID. And let me remind you, every one of those law enforcement officers who died from COVID was infected by somebody else. This is completely avoidable. I will do whatever it takes to protect my family. I would suggest you do the same. And the best way to do that right now is to get vaccinated.
A strong statement there. Dr. Persse, again, thank you for taking the time. For those of you who joined this stream at a midway point, it will live in its entirety on Facebook, on our YouTube channel, and on KHOU.com. Thank you, Dr. Persse. And to all of those watching, have a wonderful day.